अब महज 30 मिनट में ब्रेन ट्यूमर से निजात पाना संभव है। ये एक ऐसी अत्याधुनिक तकनीक से मुमकिन हुआ है जिसे पूरे दक्षिण एशिया में पहली बार भारत के अपोलो हॉस्पिटल ने शुरू किया है। ZAP-X नाम की ये तकनीक सीधे तौर पर ट्यूमर को तोड़ने का काम करती है। अस्पताल के मुताबिक 30 मिनट के सेशन में मरीज को इस प्रक्रिया के तहत कोई दर्द या किसी तरह का दुष्प्रभाव नहीं होने वाला है। विशेषज्ञों ने कहा कि ये एक तकनीक आने वाले दिनों में ब्रेन ट्यूमर के इलाज में क्रांतिकारी बदलाव लाएगी। आइए चलिए देखते हैं किसने क्या कहा है।
Of death worldwide, accounting for nearly 10 million deaths in 2020, or 1 in 6 deaths worldwide. The number of cancer cases in India is projected to go up from 14.6 lakh cases in 2022 to 15.7 lakh cases just next year in 2025, according to the ICMR. And within that, brain tumors, the rate of new cases of brain and nervous system cancers was 6.2% per 100,000 for men and women per year, and the death rate is 4.4. So it has massive mortality and morbidity effects. And brain tumors constitute about 80 to 90% of all CNS or central nervous system cancers worldwide. And it's sort of projected that about 300,000 people are diagnosed with primary brain or spinal cord tumors. But again, these numbers need to be taken with a pinch of salt because of underreporting. Up till now, brain surgery was the chosen modality to address the rising tide of brain tumor cases. But today we mark a new paradigm which will shift the way in which cancer care is given for every Indian, for every person in this region, and of course from the world over. This afternoon we are announcing the launch of the ZAP-X Gyroscopic Radiosurgery, which opens up new frontiers in modern surgical robotics for brain tumors and other conditions as well, which were previously considered unconceivable. To give more insights onto this revolutionary technology, we have a short AV to apprise you of what this technology actually does. If you could have the AV, please. And Dr. Adler, Ms. Preeta and Ms. Sunita to kindly come on to the dais. Thank you. Thank you. May I request Dr. Preeta Reddy to share her remarks on Apollo's journey of healthcare transformation. Ma'am.
Our chairman, Dr. Pratap C. Reddy, the genius, of course, Dr. Jonathan Adler, my sister and colleague at work, Sunita, Professor Pral, and Professor Rouge, senior clinicians, Anupam, Ashif, the rest of the team, Mabu. For all of you here today, I think it's an extremely significant milestone. Apollo has consistently been doing this over the past 40 years. I think when we first laid the brick for the first Apollo hospitals in Chennai, that itself was a milestone because it brought a new way of doing things, a new way of delivering healthcare to our countrymen. At that point, the mission statement said that we will bring healthcare of international standards within the reach of every individual. We did not say every Indian at that time, because I think Chairman in his far-reaching thought process said we will heal the world. So it said within the reach of every individual, and we will invest in education and research for the better of mankind. So I think the key word here is for the better of mankind, and that's precisely why Apollo is here today. there were many firsts. Dr. Adler himself was part of our first with the cyber knife. And do I say first or second? Maybe second association, but first again with the ZAP technology. But in between, we dared to dream really big, and that was with the Proton Center in Chennai, when everyone, including the board, was really not convinced that it can be a success. Today, the Proton Center has healed over 1,000 patients and has made a huge difference in patients' lives. Today, this is a promise again for the future, a promise for deep-seated brain tumors, whether they're malignant or benign, and a promise that other areas of neurosurgery will also be part of what the ZAP-X can do. So I think the future, with the fact that we are relentlessly investing in technology, training the best manpower available, investing again, and I think our clinicians are probably our greatest and our best investments, and I would like to thank all of you for being part of this journey over the 40 years, and the supporting staff, because without them, the nurses, the technicians, the housekeeping, and everyone who's part of this vision and the leadership team, nothing is possible. And I think you've all come together to help us achieve this. And I think this is again one step, another giant leap for the Apollo team, but a leap which will make a difference in people's lives, not only in our country, but for the rest of mankind. Today, India stands tall in the global scenario, and we say that we will heal in India, we will heal by India, and we will heal for India. So I think we will heal in different aspects of where healthcare is required, and that's a promise I think all Indians stand tall and have made to themselves. But before I conclude, I would really like to say that there's a very clear direction from Chairman that as many hospital beds which we build, and I know we're building another 2,000 in the next couple of years, is that we really have to be committed to keeping people well. Because that is a larger and a deeper commitment about keeping people well, and that's really what Apollo is here for. And for that, there are two, while it is an announcement, it's a lot of backstage work, is that we will keep all our centers open on Sundays, because Chairman always tells us that sickness has no holiday. So whether it's a Sunday or a public holiday, Apollo will be there to predict the onset of disease, try to find it early, and that's under the program of ProHealth. And I would like to wish all the amazing women in the gathering a very happy Women's Day. But being a woman is not easy. And when we're talking about keeping people healthy, it's actually the woman who makes a decision. So can you go out there and see that the rest of your family is healthy, that they have their checkups, and if we decide to do it, I think it can really happen. So thank you, God bless, and it's always so heartwarming to be among this amazing team in Delhi. Thank you for all the hard work that you put in.
Thank you, ma'am. I'm delighted to now invite inventor extraordinaire and clinician, Dr. John R. Adler, to speak to us about ZAP-X and how it will transform clinical paradigms. Over to you, Professor.
Good day. I am tremendously honored to be here today to inaugurate the latest ZAP-X in a country that means a lot to me and means a lot to the world. The most populous country in the world with significant unmet needs in healthcare. But as it has been for the better part of a generation and a half, Apollo intends to treat and save lives of countless number of patients using the new technology that we're talking about today, the ZAP-X. So for me, this has been a long journey. As a young man coming out of actually Mass General, I spent a year at the Karolinska Institute in Sweden, where the founder of radiosurgery, a great man named Lars Leksell, I fell under his spell. He was creating not just a new way of treating cancer, treating tumors, but he was thinking very much about the future of surgery. Forever, when people think about surgery, they think of pain, they think of disability, they think of anesthesia, big, expensive, long, drawn-out procedures, and oftentimes with significant collateral damage. Well, Lexell dreamed of a new world, where non-invasively we could do the same things that we can do with open operations. And when I met him, when I understood the dream, I fell under a spell. And I more or less committed my life to this path. And over the last 40 years, since I spent my time at Karolinska Institute, almost 40, radiosurgery's emerged to become actually one of the most common operations that neurosurgeons do in America. By far the most common operations that neurosurgeons do in America for brain tumor. And yet, we realize, despite all the technology, my own work creating the cyber knife, other technologies, other inventions, the gamma knife, Professor Lexell's technology, all these inventions over 30, 40 years, and yet we're treating less than 1 in 10 patients in the world today. And I'm sure it's far less than 1 in 10 here in India. So it was out of that need, out of the understanding that the vast majority of patients in the world who would benefit from radiosurgery, which is the best-in-class treatment, who don't have it, I set out to make a next-generation device, and that is what has become the ZAP-X. So you can look at all radiosurgical technology as basically magnifying glasses for ionizing radiation. When you go out in the sun, if you're fair-skinned like me, you can get some sunburn, maybe over several hours. But if you put a magnifying glass in front of the sunlight and you direct all the little beams at a point in space, you have a very different energy source, a transformative energy source. And that's what radiosurgery is, and that's what the ZAP-X is. It is a transformative radiation treatment that very precisely, with sub-millimeter targeting accuracy, can deliver intense doses of radiation to tumors anywhere in the brain and now even the head and neck. And when you do that, you can almost consistently and uniformly cure the brain tumor that you're treating. Now, sometimes you can't cure the disease, but you can almost always eradicate the tumor that you're treating. While this is incredibly exciting, the idea that we could treat with this type of technology 4 or 5 million patients a year by the end of this decade, and maybe 1 million patients just here in India, starting here with Apollo. It is also becoming increasingly understood, particularly by the research team that I'm working with, that radiation doesn't just kill tumors, that the right dose of radiation to the right target can actually change the activity of a circuit that can cause diseases like addiction and depression. So it is believed by me and others in the field right now that this device will not just be a cancer device, but may have commonplace procedures someday for things like depression, addiction, obsessive compulsive disease. So stay tuned. This area of surgery, I think, is going to blossom and grow. And it's going to grow very much in India, starting with this incredibly bold decision by the chairman and Apollo Delhi to acquire the first ZAP-X here. So I am honored, I'm delighted. Thank you, Dr. Reddy. Thank you, the Reddy family. Thank you, the Apollo Hospital. Everyone who's made this a reality. And I can promise that there will be thousands and even tens of thousands, and someday in all of India, millions of patients who are going to benefit from the decision you made here and now. So, namaste.
Thank you, Professor Adler, for setting out the vision of what this technology will do, can do, and in the future, what is on the horizon. Thank you so much for your insights. May I request Ms. Sunita to kindly address us all.
Namaste and good afternoon. Our beloved chairman, Dr. John Adler, my sister Preeta, members of the Apollo team and the visiting doctors who've come to celebrate this very special occasion on this very auspicious day. Thank you all for being here. As I look, Apollo started 41 years ago, and as I look at the impact that such hospitals, such healthcare, and such vision can have on India, I can only give you a few statistics to mention this and elaborate on this impact. For 41, when we started in the 1980s, life expectancy was 56 years old for the average Indian male. Today it is 70 years old. Maternal mortality has improved by a factor of 4, has decreased by a factor of 4. Infant mortality has decreased by a factor of 6. 80% of the patients who come to places like Apollo and other corporate hospitals used to go abroad for treatment. We were losing doctors and surgeons who would travel overseas to practice. We stopped the brain drain. But more important, today Indians have an opportunity to get world-class healthcare at 1/10 of the cost. And this has benefited not just Indians, as Preeta has said, but patients from 147 countries now come to India for healthcare because of the clinical outcomes that we offer. Part of this journey was when we first started Apollo. We were mending hearts, we were fixing broken hearts, we started that way, and we continue to do that. So while we've improved life expectancy, a significant part of that journey that Chairman is very passionate about is preventive healthcare. And in this space, we believe that while we've looked at survival and we've done that very well, life expectancy has increased. We want to improve the quality of life because the impact of NCDs could cost this nation $4 trillion. And this is what we want to prevent. And I think this is part of the purpose of Apollo, to look after human life. And in doing so, we've done so in such a way that we move closer to the consumer. Clinics, daycare centers, cradles, different formats of care that is closer to the patient in every which way. And now with the launch of 24/7, our digital app, which creates a comprehensive network of care that can look after patients wherever they are in India, through telemedicine, through your phone. And that is how advanced we are. And we do it for a single reason. It is because we care for each and every patient. We care for the lives of our people and for all those people around the world. Every time Chairman takes a risk, I take a deep breath. And I must say that the reason I do so because, when he takes a risk, I have to say this wonderful team here, he does it, I do, all of us do it with the confidence that this team will deliver on the outcomes. So while we are in a very happy position of sitting in a boardroom, it's all of you that do the hard work, whether it's the clinical outcomes that the doctors produce, the managers who make sure that this equipment is utilized well, and all of you, the press, for educating the public on what more can be done so that we improve the quality of lives of everyone. May God bless us all on this very special day. Thank you.
Thank you, ma'am, for your address. We'll open for a brief Q&A. If there are any questions that you'd like answered, we're happy to address those. If you just pass the mic to the far end, please. We have a question there.
So my first question is how radiosurgery is better than radiotherapy, especially for brain-related ailments and procedures. And also, if you could, as you are the creator of CyberKnife, if you could highlight how ZAP-X is better than CyberKnife. Thank you.
Thank you, sir.
I would liken radiotherapy to what I described as sunlight. So there is a energy and effect from sunlight, but it takes many, many days, many weeks even, or even hours and hours and hours of exposure to sort of get any effect. And oftentimes the effect is rather muted, it's kind of limited. The ZAP-X, by concentrating the radiation very intensely, really an order of magnitude more intensely than you're doing with radiotherapy, allows a much more potent effect. And so in the net result is a surgical-like outcome. It's almost like cutting the tissue, but with cutting the tissue with radiation, but without opening. So the effect is just much greater potency than standard radiotherapy. Now there are situations where a tumor is very large, extensive, it's hard to even define, and in those kind of circumstances, radiotherapy has an advantage because you can treat a large region, and the effects of the radiation may or may not eliminate the tumor, but they can generally give you some benefit. But think of the way we're using radiation in the ZAP-X like a knife. Very intense, very concentrated, very precise. While radiotherapy is much more diffuse over much larger regions. The truth is, radiotherapy for the brain is gradually going to disappear. It's being replaced by the precision of and the effectiveness of technologies like the ZAP-X. Now the CyberKnife also does radiosurgery. It does radiosurgery actually for the entire body. The difference is that the CyberKnife has not been optimized for the brain. It is a generic technology to treat the brain, but treat the kidney, treat the breast, treat the prostate. And when you build in that measure of flexibility, like other technologies that do radiosurgery, you don't have as concentrated and optimized effect. The the ZAP-X from the ground up was built to optimize just to treat brain tumor or brain lesions, because many times we will in the future not be treating cancer, I believe. But it delivers the most accurate, the most precise, the most concentrated radiation technique in the brain and does it very efficiently. And your net effect is, I think you're going to benefit lots and lots and lots of patients, both here in Delhi and eventually elsewhere in India.
Thank you. The cost of the surgery is equivalent, of ZAP-X is equivalent to a brain tumor surgery, so there is no difference there. What you have better outcomes, better quality of life, and all the issues related with surgery, admission, post-op, ICU care goes away. This is done on an outpatient basis. So that is the advantage without any major cost differential.
As far as the cost is concerned, you know from day one, the vision of Apollo, my vision for the country, is to see that we bring excellence in clinical care with care and compassion. But most important, so that more people can get an access to it, to have cost effective. This is why in everything that we have done from day one, it started with heart surgery, it started with everything that's happening in medicine and surgery, but it was cost-effective treatment that made us so that so many people, over 1 million people had an access to Apollo because of our cost effectiveness. So this is going to be around 5 lakhs of rupees. But this is the minimum. As I said, it is in tune with our vision to make it cost effective so that more and more people can have an access to this.
Thank you. Any other questions? Yeah, please. Can I have the mic here, please?
John, maybe you can tell what is the charge of
What is the question?
what do you
What
charge?
was the equivalent charge of
Any one of the countries where you're in.
Well, there's a spectrum. It ranges from, and I'll put it in US dollars, from about 4,000 to 15,000 US dollars per treatment. So you'd be surprised, some of the countries, in America it averages about 11,000 to 12,000 dollars.
significantly higher?
Yeah, good afternoon, this is Sanjay. My question is to Dr. Adler, Dr. Reddy. When you're talking about doing 1 million surgeries in India, and this is just going to be one installation, so how many patients are you going to treat on a single daily basis?
The surgeries on these patients.
Well, if you're asking my opinion, the typical utilization is about 400 or 500 patients is what we'd expect, but there will be locations in the world that will treat well over 1,000 patients, and I believe Delhi may be one of those places. I mean, the theoretical maximum is probably in the north of 3,000 patients per year. Now, I don't think poor Apollo Delhi is going to treat all million patients in India, but there are opportunities, I think, to fix that problem elsewhere.
So there's a high turnover that you can have, and obviously the number of 1 million is over a decade that is being projected.
And just to put the medical insurance, that's it.
It's a new modality in time that it will get covered as well. Thank you. Any other questions? We can take one more question. Yeah, there's a question there on my left.
Sir, what is the diagnosis before operation and after operation? And what the time?
What is the prognosis prior to the intervention and post, before and after?
Well, the outcome depends very much on the type of the tumor that you treat. So there's some tumors for which the likelihood of cure is impossible. We call it the most malignant brain tumor, we call it glioblastoma. It's almost impossible to cure it, but it is possible to give people many, even years in some cases, that they would never have without ZAP-X treatment. But there's other type of tumors, acoustic neuromas, meningiomas, where the cure rate is essentially 100%. So understand that think of this as a knife. It's a robotic knife. So in some cases the knife can cure, and sometimes the knife only palliates patients. But it will be beneficial for almost all patients, and we do it very cost effectively with very little morbidity, very few, very rare complications, and literally less than an hour in the machine being treated.
Is cure the paralyzed?
Sorry,
When is cure in the paralyzed, then after this, is it?
they are what? Sorry? No, there's no nothing. No, there's
Oh, sedation.
sedation for the patient.
Occasional patient can be claustrophobic, but having thousands of patients in this, it takes maybe 1 in 100 patients will need a little sedation to calm them down.
Thank you. We will have our clinical faculty available after proceedings here for your questions if you do have any.
It would be nice to put a few people of the press in the machine
Sure.
to experience it.
First hand, yeah. Proof of the pudding.
They'll become believers in surgical robots.
Yes, any volunteers, please do reach out to me. May I just request